Everybody here? So we're going to talk less about the finance side because I mean, money's important in retirement. Money's not everything in retirement. And we went through the finance stuff in fairly heavy detail, so let's talk about some of the more, some of the other pieces that go into retirement as well. So we talked about financial change, so let's talk about health and sort of planning for retirement when it comes to the healthcare side. So the next two sections will go a little bit quicker. We'll try and get you out a little bit earlier than I think it's scheduled for 4:30, but I don't think you have to go that long. So, retiree health benefits. So again, because everybody's with a different municipality, there are different health benefits for different groups. It's not MEB that provides benefits for everybody. So one of the things you need to know in retirement is what kind of coverage do you have? Because it's one thing to retire, but you also have to recognize that if you have prescription drugs that you need, if you have chiropractic that you need, or other pieces that you may not have that same coverage once you've actually retired, especially when it comes to dental and some of the other pieces that you have when you're working. So if you don't have a spouse that's still working and have coverage with them, or if you don't have post-retirement health benefits, you need to figure out what's available to you. So some employers do provide post-retirement health benefits. A number of them don't. It really depends situation to situation, but it's going to be something to look into, because when we talked about those costs before, one of the bigger pieces becomes the cost of medical and dental coverage. What do you have? The other part is, if you do have coverage, what are the lifetime maximums? In a lot of cases, if there are benefits for groups in post-retirement, usually there's a lifetime maximum in terms of the amount that you can claim. So you may at some point hit a cap, where if you're on a fairly expensive prescription drug, that cap can come up pretty quickly. So you need to figure out, what do I have in terms of additional coverage, or what kind of insurance do I need to cover these the additional benefits? And if I do have coverage, when does it end? In a lot of cases, coverage will end at age 70 or age 75. So even if you're in retirement, as you get closer to those points in time, you need to make sure that you've taken care and that you do have coverage. The government will provide some components for healthcare, but not everything. And especially if you're traveling. Out of country is especially important. And as you get older, and if you're looking to travel, that gets more and more expensive, right? So if you're 65 and retired or under and you're traveling, coverage usually isn't too bad because you're still reasonably young. But when you start getting up to 75, or you have a pre-existing condition because of a heart or issues with your knees or something, then insurance becomes expensive. Then you have to start balancing out, when does it make sense to go, when does it not make sense to go, because age matters. The likelihood of needing something and needing coverage and needing to go to a doctor or a hospital gets bigger as you get to retirement. So you need to be aware of those different pieces. Like I said, the government does cover some components. So for those of you, as you get older, eyeglasses, there's some eyeglass coverage with a $50 family deductible. So you're covered for an eye exam every 2 years, essentially. So just to check your eyes. The glasses themselves, they still cost you money, right? So you're still going to have some costs. Prescription drugs, so you may be eligible for the Pharmacare program. Again, coverage is based on your family income level and your prescription drug expenses. So if you have a number of, or a high income in retirement, you may not qualify for the Pharmacare piece, and you still may need to fund those pieces. So you still may need insurance. But the government does provide some coverage on prescription drugs, so it's important to know what you have and be able to ask about what's available. So you can apply for Pharmacare on a one-time basis or on an annual basis. So if your income actually goes down and you didn't qualify before, you may want to reapply at some point to see if you get coverage. There's a really exciting guide at the bottom when you get closer to retirement from the Senior and Healthy Living Department. I can't remember what it was before, but they renamed it the Seniors and Healthy Living Government. But it has a guide as to what coverages that Manitoba does provide to you. Healthcare becomes expensive. And it's a big challenge. So what isn't covered by government benefits? One is your travel insurance. Again, if you're looking to go anywhere, then you need to look into getting travel coverage, whether it's Blue Cross or somebody else. Make sure you have protection. It gets expensive, even for those that aren't physically thinking they're going to need it. We had a trustee on one of our plans. He's a retired trustee, but he's covered under insurance because of he's required to, as part of the trustee for one of these plans, and he ended up having a heart attack in the U.S. And so he was down there for a couple of weeks, and ultimately the bill was about $120,000. So if you didn't have coverage, and suddenly $120,000 is the bill from the hospital, it's pretty significant. It's pretty hard to make adjustments on an amount that big. So coverage can be fairly fundamental when it comes to things. Out of country, very expensive. We had, again, going back to experience from our office, we had one of our individuals, one of our employees, went to the Dominican this winter, and she ended up getting pneumonia while she was down there. They wouldn't release her from the hospital until a guarantee of payment was going to be made from the insurance company. So even though she had recovered, they had security guards at the door of the hospital, of her hospital room, to make sure she couldn't leave, because they wanted to make sure payment was made. So you do need to be aware and make sure that you have the proper coverage, because you don't want to run into these issues. Prescription drugs, again, depending on your income level, may or may not be covered. So if you have a higher income, you're probably not going to be covered for as much on the prescription drugs. Dental care is not covered, and that tends to be one that people forget about. But you still need to go to the dentist, still need to get your teeth cleaned, still need to get them maintained, or you can get them all pulled out and just put dentures in if it's a cheaper option for you. But dental, people forget about dental care a lot of times, and so you get a cracked tooth or something like that, those costs can really add up, and that's not covered. So coverage in retirement on dental can be important. The other part that you have to remember is you are all living longer as well. It's not the same as it was 15 years ago, 25 years ago, 50 years ago. So this is a very, very exciting chart for me, because I'm an actuary and I like mortality rates, so this is really exciting, but it's life expectancy. So what the Statistics Canada did was actually project out life expectancies based on three 25-year intervals. So we have 2009, 2010, 2035, and then 2060, sort of where they see in terms of average life expectancy. And you look at the number of deaths per 1,000 per age. So right now, this is male, this is female. If you look at 2009, the average male was living around 85 or just below. Female is a little bit higher, just because of the way the bulge is. So it's probably about 87, so 85, 87. If we project up to 2035, the average male is going to live to about 90, and the females are probably 91, 92. By the time you get to 2060, average life is going to be about 95 years old. So, it's not just about what am I going to do in retirement today or tomorrow because I'm 60 or I'm 65. But more and more, you also have to start thinking about planning for what happens when I'm 90, because more likely than not, a number of you in this room are going to get to age 90. And you see the odd water surfer, parachuting grandma at age 90. But at age 90, for the most part, it's a bigger challenge because mobility becomes an issue for individuals. In terms of just getting around, almost, I believe the stat is around 60% of individuals over 75 have some sort of mobility issue, whether it's knee replacements, hip replacements, back issues. Mobility is a challenge, and it just, our bodies do break down over time. As much as we can replace parts and put in new knees and that. I mean, I've got two parents. They've got one actual knee between the two of them at this point because the other three have all been replaced. So it's they just hand off. But that's the reality. Is most individuals at some point you're going to have experience in terms of mobility issues, and so that's going to affect your retirement and your health care and what you need to do. Because if you're living to 90 and you do have these challenges with mobility issues or other items, it can affect how you live in retirement. So you need to be aware and make sure you have coverage, have healthcare planning. and have the insurance to make sure you're protected in terms of some of these pieces. So the other part is costs increase over time. So if we look at just in terms of age, the annual prescription drug cost for individuals, right? So for an individual between 65 and 74, the annual prescription drug cost is about $1,500. 75 to 84 goes up to $2,000. Individuals 85 plus, they're paying about $2,200 a year in terms of additional prescription drugs costs. So this is stuff that's not covered, right? $2,000 a month, if that's a month of your pension that you're now paying for prescription drugs, again, it can be challenging. So insurance becomes part of it, making sure you have enough coverage to understand what you might need over time. I'm not selling the insurance, I'm just saying just be aware and make sure you're covered. But I mean, the important part is you are living longer, right? The pension plan, what happens is year over year when these valuations are done on your pension plan, the expectations for life expectancy go up. So where it used to be, oh, everybody's going to live to 80, now they're projecting out to 85, to 88, to 89, 90 in some cases for individuals, because the plan needs to be able to fund, assuming people are going to live for 30 years in retirement now. If you retire at 60 and the average life expectancy is 90, goes to 90, you've got 30 years of retirement that the plan has to make sure it can fund for. And in most cases, people's working life has only been 30, 35 years. So you're almost living as long in retirement now as during your working years.
You forgot about climate change and world wars.
Yeah. I haven't read Twitter today, so I'm not sure what's happening in the World War side, but yeah. So, but there's a number of factors that you need to deal with. So, okay. The other part of that is pension plan has to fund for it, but if you are using personal savings, you have to make sure that it's going to last longer too. Your RSPs, if you're not comfortable just living off of your pension and your CPP and OAS, you need to make sure that you have some flexibility in your RSPs or other savings so that when you are 85 or 90, if something comes up on the medical side, you have some income. But also just for general living expenses. 85 versus 90, you've got another 5 years of managing costs that you might have to work with. And taking care of yourself reduces the cost of your ongoing health care. So when we talk about health and retirement, it's not just about what do I need insurance, but ultimately being active, mentally active, physically active. It's all very important because it will reduce the likelihood that you're going to need additional medical care in retirement. So going out for walks, whether you like to golf, doesn't matter. As long as you're still being physically active in some way, shape, or form, it's important because it's going to help you in the long term to reduce your overall healthcare costs. And when you're retired, it's not like you don't have time to be active and do things. You have time to go for those walks or do other exercises. So wellness is important. Wellness is a big part of it. So what we've seen just in general in our industry is not just no longer the focus on am I financially ready, but it is a lot more about what do I want to do in retirement? What am I planning to do? How am I going to live in retirement? And being active is a big part of that. That's why you've seen a lot more promotion in terms of active seniors and different items from the government because one, they know it's going to reduce the cost on the healthcare system if people are active and physically able to do things. But just in terms of your own experience, what do you want to do? You don't want to be sitting in front of the TV for 8 hours a day because physically you can't do anything else. You want to be able to enjoy your retirement, do the things you want to do, and part of that is making sure that you can stay physically healthy. So healthcare is important. Mobility, again, it's becoming more of a challenge as we age, but there are ways to take preventative action to make sure that you are still able to retire and be able to do the things you want. The other part of it is, when it comes to healthcare, is making sure that it's not just you, it's if you have a partner or whoever else, that they are being active as well, because your lifestyle in retirement can change depending on their physical abilities, right? So if one of you can't do a lot, it does affect the both of you, because if physically they're struggling to be able to go for a walk because they need a knee replacement or something else, it does affect the both of you. So it's not just an individual, but it's a family thing, and collectively doing it together does make it easier to try and be active and keep going and actually just have a better and healthier retirement life.